My name's Ben Barnes. I'm a neurologist at the Medical College of Georgia in Augusta, Georgia, originally from Australia. I'm here at the AAN because I recently became the adult residency program director for our neurology program, and I'm here to learn about education. Yeah, I got one of the A.B. Baker Teacher Recognition Awards. It's an award that's used to recognize people who are very committed to teaching and potentially have a future as physician educators. So first of all, let me give a shout out to Dr. Rivner, Dr. Brandy Qualls, Christy Bouchard, and Rebecca Nalor, who's Dr. Rivner is the ALS clinic director, and the rest of the people I mentioned are part of our research team. So they do a lot of hard work and help me get through quite a lot, actually. So ALS in general, as we know, it's a progressive neurodegenerative disease that unfortunately is relentless. So it results in people getting progressively weaker in different areas of the body. And unfortunately, we don't have a cure yet. There is a lot of research going on at the moment, particularly focusing on different types of treatments for ALS. And we're hopeful that some of those show positive results in clinical trials. And we're also trying to understand the mechanism behind ALS. So I think as a field, we don't really understand it on a cellular level as well as we probably should. Well, I think the number one thing is to present the diagnosis in such a way that it's not a final and very pessimistic thing. I think to instill as much hope as possible is very important for these patients. So the focus, for me at least, shouldn't be on the diagnosis itself. It should be about what you can do about it. So things like getting involved in a multidisciplinary clinic, getting involved with physical therapy, occupational therapy, respiratory therapy, the medications that are available at the moment, and getting involved in research trials. So I try to spin it all in a very positive, here's what we're trying to do with it manner, rather than focusing on the diagnosis itself. I think just about every one of my ALS patients is involved in some kind of an online support group or in-person support group, and I think that's really important for them and their families too. I would say the biggest thing in the ALS landscape at the moment is something called the ALS Platform Trial, which is run out of MGH, headed by Sabrina Paganoni and Merit Sakovic. It's a platform trial, so they're trialing out all sorts of different medications that have mechanistic plausibility, and we're trialing them out in large-scale clinical trials. And I think that really holds the best hope for a cure or an effective treatment in the future. It's not a registry per se, although registries do exist. This is a trial that involves patients qualifying for the trial in general and then qualifying for each particular arm of the trial, if you will. So they have different regimens. We're up to regimen G, I believe, at the moment. So there's regimen A, B, C, and in each one of those regimens, they trial out a different medication that shows great promise in the preclinical and early clinical literature, but hasn't been trialed on a large scale yet. So it's very systematic in the way it approaches ALS research, which is why I have confidence in it. Finding something in the future. I think for me this is kind of a personal thought, but I think we really need to understand what the mechanism behind ALS is much better as a field. And I think probably when we understand the different pathophysiology behind different subsets of ALS and different presentations of ALS, I think when we understand that better as a field, we will be able to move forward more efficiently in our treatment.